Hello everyone. I am very happy to see you all here again after the short summer break that EUROSTUDENT Talks had. Perhaps many of you remember that during our webinars in spring and early summer, we introduced different topical module reports and their findings. And the last topic that we didn't manage to cover before our break in summer was students' mental health and well-being. So this is the thing that we're going to discuss today. And I'm very happy to have here two authors of this topical module report, Ardita Muja and Joris Kuppen. They both work at ResearchNet, a company based in Nijmegen, the Netherlands, which is also part of the EuroStudent Consortium. Ardita is a researcher and she obtained her master's degree in pedagogical sciences and sociology. And in 2020, she finished her PhD at the Department of Sociology at the Radboud University in Nijmegen. Her dissertation focused on the school-to-work transitions among students. And Ardita's colleague, Joris, is a senior researcher, and he has been doing policy research on education since 2015. He has a background in sociology and human geography. They are both mostly active with quantitative research on Dutch higher education, and in the EuroStudent project, Joris and Ardita are both involved with the data collection, including Dutch data, and guidelines on data procedures and harmonization. They are also coordinating the creation of the EuroStudent microdata. And other research, Ardita and Joris are active in involves research on transitions and trajectories in the Dutch educational system, well-being of students, discrimination, and safety. So they will introduce us the topical module report and its findings, but this is not all. We are also going to have a deeper look into students' financial difficulties and its impact on student well-being. And this will be covered by Mikael Reichelgaus. Mikael is one of the authors of the intelligence brief that we are soon going to publish. It's not available yet, but it will be quite soon. We'll let you know. And Mikael will already today share some results with you. Mikael is an analyst at Praxis think tank in Estonia, and he holds a master's degree in mathematical statistics from the University of Tartu. Since 2022, he has conducted data analysis for several research projects in Praxis related to education, health, and social policy. So greetings to all of you. I'm very happy to welcome you here. And as we have two topics to cover, I think let's start. And you go first, Ardita and Joris.
Thanks, Marleen, for the introduction. I hope I'm sharing the screen correctly.
Yes, we can see.
Great. Yeah, so also from our side, welcome everyone. We'll give an insight in our findings on well-being and mental health. So in the wake of COVID-19, there were increased concerns about mental health, which led to the inclusion of a topical module on this subject for EuroStudent 8. So we will present two reports, basically. The first one is the topical module report, which Marleen mentioned, which was published in April this year. And we also have a more in-depth report, which is also to be published soon, but we're not sure yet when, coming months. To dive into the results, first, we'll show the mental health per country. So you can see in this picture two things. First of all, if you look at the total size of the bar, that indicates the percentage of students per country who indicate that they have a mental health problem. So you can see on the left, there's Sweden, where it is almost 30%, and on the right there's Romania with close to 2%. So that's the total percentage of students indicating they have a mental health problem. But in the questionnaire, we can also distinguish, first of all, whether it's limiting in their studies or not. So they could say, yes, I have a mental health problem, but it's not limiting my study. That's depicted in the dark blue part of each bar. Another differentiation is whether it was diagnosed or not, which was a follow-up question. So you can see the light blue part for each country is students who indicate they have a mental health problem, which was limiting, but they didn't receive a diagnosis for it. And then the students who did have a diagnosis, we also distinguish between whether they are being treated for it or not. And for this last part, so students who are who do have a diagnosis and are being treated for it, we can see that it for each country, for the participating countries, it ranges between 1% or less than 1% up to 11% in Finland. Then for the students who indicate they have a mental health problem and who indicate that it's limiting them in their studies, we did have a follow-up question, namely, what is the specific type of mental health problem you're dealing with? And we can see for all the countries that depression and anxiety disorder are the two most common ones. Besides that, less common is eating disorder and ADHD, but the pattern looks quite similar for all the countries. So to be clear, this is for instance for Lithuania it's 80%, but that's of course then 80% of the group who indicates they have a mental health problem, which is limiting them. Then another topic we've covered in the topical module is isolation. For isolation, we distinguish that in four categories. And we can see in the dark blue bar for each country that, the light blue segment, that's relating to whether they feel isolated to fellow students. And yeah, that seems quite high in general, because in a lot of countries, more than a third of the student population indicate that they have that they feel commonly isolated from fellow students. To other For other categories, it's lower. For instance, for a family and partner, it's the lowest in general. But yes, especially the fellow students seems quite disturbing that this is so high. And of course, yeah, Finland even more than 50% of the students. Another topic we've covered is the counseling. So we ask students whether they use it, which you can see in this graph. And in the dark blue part, you can see the students who know it and indicate that they have used it. So that ranges up to 90% of the students. In some countries, a lot of students indicate that they haven't used it and that they're not aware of it. Of course, this is the perception of the students, so this does not indicate whether it's existent or not, only that they're not aware of it, which could be due to the fact that it's not there. The next question relates to whether they are satisfied with it, and that looks more positive because this relates to the students who have used the psychological counseling, and we can see here that the majority of the students find it helpful. So that would be the dark blue and the light blue. If you take that together, then yeah, in all countries, the majority or more than up to 75% seem to find it helpful. Then well-being, the well-being of students, we've measured this with 5 separate items, and we combined the answers, and it results in a range from 0 to 100, with 0 being the lowest, 100 being the highest. And in the literature, there are certain thresholds which are used, namely 50. So a score of 50 or lower would indicate a low well-being, and a score of 28 or lower would be a very low well-being. And to illustrate how you get a score like this, we've made 2 examples. So for instance, student 1 says that for 2 answers, he says more than half the time, feeling cheerful and in good spirits and active and vigorous. And if he indicates for 3 items less than half the time, he would get a score of 48. So this would be categorized as low well-being. And the bottom, student 2, if he says for 3 items some of the time or worse, and 2 of the items less than half the time, he would get a score of 28, which would be a very low well-being. And of course, if you would indicate at no time for each item, you would get a score of 0. So with this score, we have looked at the part of the students who indicate that it's score 50 or lower, which you can see here. So in the bar, you can see the percentage of that, the size of that group. So on the left, you can see Poland, where 58% of the students indicate that they have they get a score of 50 or lower, which is, yeah, the worst result in this case. But also in Iceland, which you can see on the far right, it's the most positive outcome, but still there, more than a third of the student population, according to this scale, would be categorized as low well-being. So quite alarming, I would guess. And also on average, we can see that 48% of the students are categorized as low well-being with this scale. Then in the report, we looked at some characteristics, which we will delve into deeper with our follow-up report. But to give a first insight, we looked at whether students experience financial difficulties, which you can see in this graph. So in the blue bar, you can see the students who indicate that they do have financial difficulties. Light gray is with some financial difficulties, and the dark bar is without financial difficulties. So there's a clear indication that in each country, the students who do have financial difficulties have a lower sense of well-being. And we can see this pattern for all the countries. For some, there's a bigger effect, and for some it's smaller, but yeah, there's clearly a linear relation to this. So that was the part on the topical module. I'll give the word to Ardita, who will talk about the microdata report.
Yes, so Joris has talked about the topical module, and in this report we tackled the first research question you see here. And we looked at several health indicators. And in the second part of this presentation, we will focus on the second research question, and we'll zoom in on the last indicator, which Joris talked about, so the mental well-being index. So the second research question reads, which students are more at risk of a poor well-being and why? And to answer this research question, as already mentioned by Joris and Marleen, we used the EUROSTUDENT 8 microdata. This is the scientific use file. And for our analyses, we were able to use data from 11 countries, 11 EUROSTUDENT countries. So which students are more at risk of experiencing poor well-being and why is the question. Joris, could you move to the, yes, thank you. Which students are more at risk of experiencing poor well-being and why? Following the study demands and resources framework, we argue that study demands and study resources are both related to one's well-being. And study demands can be defined as very broadly as physical, psychological, social, or organizational characteristics of studying that require physical or mental effort by students and are therefore associated with certain psychological costs. And study resources, on the other hand, can be defined as the same physical, psychological, social, or organizational aspects of studying that are actually functional in achieving study-related goals or stimulating personal growth and development, so the good things, you could say. And we argue, following this framework, we argue that high study demands and the lack of study resources are positively associated with poor well-being among students. However, study demands and resources do not explain all variation found in the well-being between students. Joris? Yes. We know from previous research that background characteristics of students are also related to well-being. So we take these characteristics into account as well. For example, gender, having a disability, SES are also all related to one's well-being. So we add this to the framework. Next, students also differ in contextual conditions. And here we were interested in what we call the academic context and the personal study context of students. So the academic context include, for example, field of study of the student and the type of degree. So master or bachelor's. So that's the academic context of students. And the personal study context includes, for example, their housing situation, living with fellow students or with family, but also perceived financial difficulties, just to name an example. Because it is very difficult to test causality of these paths in the framework without longitudinal data, we will examine the relationship between these different factors and student well-being. So that's also important to keep in mind. We don't talk about causal effects, but associations. So to sum this all up, our hypothesis is that we expect a stronger relationship with poor well-being among students with vulnerable backgrounds, students with less resources, and students that generally experience more study demands. So how did we measure all these concepts? All these variables are mentioned in the framework. And because there are a lot of variables included into the models, we will only briefly discuss the most important ones. But we can, if you have any questions, we can come back to it at the end of the presentation. But I think the most important ones are the study demands variables. These are like time spent on work, time spent on studying, time spent on commuting between your home, students' homes and their university, and having childcare. And study resources are, for example, self-assessed social integration into higher education, extent of contact with fellow students, perceived chances on the national labor market. Yeah, and some variables such as age speak for themselves. So if there are any questions, we can answer them at the end. Moving on, we conducted multi-level linear regression models on well-being, and we have 5 models. Each model builds upon the next one, and each model is one block of the theoretical framework you saw. So, for example, when you see here in the results, you see model 1 is only includes the socio-demographic background of the students. Model 2 adds then the academic context. And then model 3 adds personal study context, etc., etc. And then final model, model 5, is the full model, including all the variables. So the red bars indicate significant and negative relation with well-being. Green is significant and positive relation with well-being, and the yellow bars are non-significant relationships. So if we zoom in on socio-demographic background, we see actually across all the models, we see in general that older students, male students, those without a disability, and students with more wealthy parents report on average a better well-being than their counterparts. So we see some social inequality here, you could say. Moving on to the relationship between study demands and well-being, we see that working hours, which is quite surprising for us at first, now not that much anymore, but that students who work more have a better well-being in general. But it's also possible that this is a reverse causal effect. It's possible that students who have a lower sense of well-being are less able to keep a job, or less able to keep it or to find one. So that might also explain this relationship between working more and having a better well-being. Second, we found that a longer commuting time is associated with lower well-being. So if it takes you longer to get to university, it's generally associated with lower levels of well-being, which would fit into the framework of study demands, that they have a negative impact on well-being. And lastly, studying more hours than the conventional norm. And the conventional norm is between 30 to 40 hours, is negatively related to well-being. So you could say that spending time on studying is good, but don't spend too much time on it, because then it's not good anymore for your mental health. And then regarding study resources, we found the following. We found that experiencing good national job opportunities, having more contact with other students, having high quality lecturers, and experiencing a higher sense of belonging with higher education are all associated with higher levels of well-being. So what are the conclusions then of our report? First of all, we found that the results Joris has presented, that a substantial part of the students indicate that they have a poor well-being. And the second report shows that there is clear inequality in having a poor well-being. So students students' backgrounds matter. More privileged students are more likely to have a better well-being. So students with wealthy parents, for example. And student study demands and resources matter as well. We found that students with the highest time spent on studies have generally a lower well-being. And we found that study resources generally have a positive relationship with well-being. So we would say to stimulate academic integration with fellow students and teachers to improve well-being among students. Are there any questions?
Questions are very welcome. Before we move on to Mika's presentations, there are time for a couple of questions at the moment as well, but we can have a general Q&A later too. But if you have any questions to Joris or Ardita at the moment, then please put it to the chat or raise your hand and let us know. Actually, what I was wondering myself is that, as we know, there are some fields of study and study programs that are maybe more demanding. They have more study hours. Did you check that as well, whether different fields of study affect the student well-being or not?
Yes, we did have that in the models. Here you can see it. So you see the different fields of study. There are quite a few, and you see that they differ. So the fields of study with a generally lower well-being are ICT and engineering, compared to the reference group. And the reference group is business administration. So yes, it also depends on what type of study you're doing. And you could argue that it might have to do something with how demanding that field of study is.
Yeah, it sounds quite logical. But we have another question in the chat as well. Frauke is asking that how is COVID influencing these analyses, and as mental health deteriorated a lot during the pandemic?
Yeah, so this is data from the first half of 2022. For most, the COVID epidemic was in its end, that period. But of course, we cannot assess how this would have been without COVID. There is a question in the questionnaire on what students, how they assess this, actually, the impact of COVID on their well-being. In most cases, it's negative. And for minority, they indicate that they have actually positive, they expect, or they think it's a positive effect on their well-being. But majority indicated it was negative.
Yeah, I think another question that just came to the chat box is actually connected to that. It's the question that, is it somehow possible to read from the results how much did the global anxiety, for example, COVID, war, etc., affect their mental well-being? We discussed COVID, but case of war and this uncertainty connected to that, this actually goes to that period as well, right?
Yeah, it is a interesting topic for follow-up research. What is causing this low sense of well-being? It could be global factors. Students are not isolated from society, so this thing would affect all young people. But it can also be study specific, like stress for exams, things like that.
Yeah, there are two more questions. One is about the results from financial difficulties. Julia is saying that the distributions of the results do not sum up to 100%. Can you explain how this is measured or presented here?
Yeah, so this is what you see is the percentage, same to this graph. So here you see the part of students who indicate they have a low sense of well-being, and this is that same percentage, but then divided in three groups, whether they experience financial difficulties or not. So it's not supposed to add up to 100%.
Thanks for this explanation. Yannis is asking, is it the first time that the EUROSTUDENT survey establishes a link between academic burden and mental well-being?
No, there is literature on, there's plenty of literature on academic burden leading to lower sense of well-being. And yeah, of course, we also use that in our paper. And yeah, with this paper, we try to add something, of course. Yeah.
I am very, very happy to see how many questions we have today. Another one, did you look at experiences of people who have a background connected to families who have a recent history of migration or who are perceived as migrants themselves? I think the migration background was somewhere.
Yeah, the social was in the social demographic background. So we had students without a migration background as a reference. And then you see in the last model, international students indicate they actually have a better sense of well-being. But in our first model, we saw negative associations for all students with a migration background and international students. So yeah, this negative effect is later in our analyses explained by other factors. For instance, if they all have a lower sense of well-being, lower sense of integration, then it could be that explains why migration background students have a lower sense of well-being.
Yeah, and I think the last question for this presentation is that did you get any indications of how to include or reach to students who self-isolate due to social anxiety, language barriers, etc.?
No, there's no. The only part of what students indicate is, or what is more related to what could be helpful in the questionnaire is whether they find their psychological counseling sufficient or not. But we didn't ask. We didn't look how to include or reach students.
Yeah, thank you, Joris and Ardita, for the presentations and for the answers to all those questions. Before I hand over to Mikael, I remind everyone that we can still discuss the mental health and well-being topic in general also in the end of the webinar. But now, Mikael, handing over to you. The floor is yours.
Thank you, Marlene, for the introduction. And I will now present the intelligence brief me and my colleague Elizabeth Kendrelly wrote on the role of financial stress in student well-being. So the image of a poor and struggling student is almost a cliche, though one backed by data. While financial stress is often seen as a normal part of student life, it can seriously harm well-being. But can financial stress explain why some students have worse mental well-being even when we consider all other relevant factors like family characteristics and social relations. So this was the question I and Elizabeth set out to explore. And now, at first, a few words on the concept of financial stress. Financial stress can be broadly defined as a subjective measure of one's inability to meet their financial obligations, and challenges such as high tuition fees and growing living expenses can in turn lead to anxiety, depression, and academic underperformance. So previous studies have demonstrated a clear relationship between financial difficulties, poor health, and well-being among students. As we've just heard from Ardita and Joris, it was also one of the points raised in their topical model. And as of now, on average, 1 in 4 EUROSTUDENT respondents report experiencing serious or very serious financial difficulties. Now, this indicator varies considerably across countries, ranging from 15.2% among Romanian students and up to 40.5% among Georgian students. In the most states, nevertheless, at least a fifth of student population reported experiencing significant financial difficulties, as can be seen on the slide with the graph. Additionally, 1 out of 4 students say that the COVID-19 pandemic has negatively influenced their ability to finance their studies. So considering how widespread this phenomenon is among students, it is essential to examine the role of financial stress and how it is linked to well-being amongst economic challenges like increasing inflation and increasing accommodation cost. So at the same time, it is important to keep in mind that mental well-being is a complex issue influenced by many factors. Me and my colleague Elizabeth did a dive into the literature and identified a bunch of factors previously associated with mental well-being, such as demographic characteristics like age or gender, or academic characteristics like study intensity, social and relational situations such as social isolation, family background, for example, the level of parental education. And Elizabeth and I set out to isolate the impact of financial stress on student well-being. So the question was, how much change in mental well-being can be attributed to financial stress after we account for all those conditions listed on the slide? And here, a large multi-country data set like EUROSTUDENT Data is invaluable, as it offers stronger evidence to support advocacy efforts aimed at increasing funding for financial aid, for example. Now, another thing we wanted to know was to what extent is the impact of financial stress moderated by a broader context of financial deprivation? In simpler terms, if most students around you are also struggling financially, it may perhaps feel less unfair and have less impact on your mental well-being if you experience financial issues yourself. If that is the case, we thought that if that was the case, then policies that promote open discussion and kind of not normalize, but help you feel normal among while experiencing financial challenges and get peer support. Those efforts could reduce the negative effects of financial stress if this prevalence theory was true. So essentially, we had 2 hypotheses we wanted to prove. The first hypothesis was that financial stress is indeed linked to mental well-being even after we consider all the other listed factors. And our second hypothesis was that in countries where financial stress is more widespread among students, it has a lesser impact on their mental well-being. yeah, so those are where our hypotheses. Now let's move on to the analysis part. First of all, we used the WHO Mental Wellbeing Index that Adita and Joris already introduced to you. I will just give you a quick reminder that it is a score on a scale from 0 to 100. So when you look at the graphs that are coming, you won't be confused. And the second metric we used was the experience of financial difficulties. So students were asked how seriously they would rate their financial difficulties, and on a 5-point scale, with 1 indicating no financial difficulties and 5 indicating very serious financial difficulties. So just for clarification, we reversed the scales for the analysis, so that 5 would be like more severe financial difficulties and 1 would be less severe financial difficulties. Although in the original questionnaire it was like 1 was the worst and 5 was the best situation. Now, when we look at the aggregated country level data, at least for the means, then there is no clear connection between mental well-being score and mean financial difficulties. As you can see on the plots, the country points are scattered quite randomly. But don't be discouraged. That's exactly why we need to look at the individual level data. At the same time, it is important to keep in mind that students within one country may share similarities due to some state-specific conditions that may influence both their overall mental being and mental well-being, and the extent to which financial difficulties affect their mental well-being. So, for example, if you look at this plot, then Georgia has a high mean level of financial difficulties. In fact, one of the highest among the countries, and it's at the same time it has a pretty high average mental well-being score. So you may ask, well, that's a bit counterintuitive, but perhaps it's because people in Georgia simply have better social relations or healthier study practices. It could also be the case that the weather is simply so nice and the wine is so good that financial struggles affect students to a lesser extent. They're not that much worried about your financial situation. We don't know that, in fact. And in order to account for that kind of unknowns, we used a thing called multi-level model with a random slope for financial difficulties to account for the countrywide differences. Furthermore, in our model, we also included a bunch of control variables for all the factors that are linked to mental well-being that we discussed earlier. And finally, we calculated the percentage of respondents who indicated serious or very serious financial difficulties for each country, to see whether the prevalence of such struggles among the student population in general makes a difference at the individual level. So that's the prevalence hypothesis. Now, the most important discovery of our intelligence brief was that our first hypothesis turned out to be true. Financial difficulties at individual level maintained a significant negative effect on students' mental well-being, even after we adjusted for all of the control variables and country level random effects. So on average, a 1-point increase in financial difficulties resulted in a 3.2 decrease in WHO Mental Wellbeing Index. And just a reminder, financial difficulties is measured on a 5-point scale, and the mental well-being index is measured on a 100-point scale. So this means that all else being equal, students having the same social relations, the same parental background, same gender, same age, and all the other factors listed on the slide that was here before, All other things being equal, a student experiencing very serious financial difficulties would have a 12.18 points lower mental well-being score than a student reporting no financial difficulties at all. So that's quite a significant difference, exceeding like half a standard deviation for from the mental well-being in general. And this finding is important because it shows that financial stress consistently harms students' mental well-being, and it is an issue that demands to be targeted head-on. On the other hand, our second hypothesis that the impact of financial difficulties on mental well-being is moderated by their prevalence within a country's student population was not supported by the present data, at least. The number of one's compatriots experiencing financial struggles did not seem to make a difference on how your personal financial struggles affect you. Based on these results, we would, me and Elizabeth, who is not currently present, would like to propose 3 policy recommendations. First of all, the link between financial stress and mental well-being shows the need for more funding for student financial support. This evidence can help student advocacy groups push for more resources and programs like public support, emergency grants, or financial education to ease the financial burdens of students. Students could also really benefit if the mental health services and financial aid offices work together, both online and on campus. For those facing financial stress, having easy access to mental health support could help reduce its impact. Similarly, students seeking mental health support might also find it helpful to have financial counseling available at the same time. And finally, mental health professionals at universities should be encouraged to recognize the connection between financial struggles and mental well-being. It could be helpful to include financial stress screening as a part of mental health assessments whenever students turn for mental health consultations and services. Now, given those policy recommendations, I would like to finish and thank you all very much for your attention.
Thank you, Mikael. Any questions to Mikael about his presentation? Again, raise your hand or put your question to the chat. We can react in both ways. I was thinking, before Joris and Ardita mentioned what was surprising for them when they did their analysis, for example, that how working hours affect the well-being. Was there anything that surprised you and Elizabeth when you were doing your analysis, besides the fact that your second hypothesis was in the end not correct, but was there anything else that was especially surprising or somehow you didn't expect kind of findings?
I think that after Adita's and Joris's very thorough topical module after reading is there were no really surprising facts. If I hadn't read the topical module before, I would probably be really surprised by how much mental well-being differs by gender and how much actually gender affects this people's experience. Yes, that would probably have been the most surprising result for me if I hadn't read Joris's and Ardita's report earlier, where they actually pointed out the same thing. So
yeah, very interesting. Any other questions to Mikael? Or even to Joris and Ardita? A wide discussion can be open as well. We still have some time left, so it's very welcome. Until you think, I actually started wondering that when we look at the data and also, as Joris and Ardita presented in the beginning, that the countries differ a lot when we look at the share, how many students indicate mental health problems. I know it's a tricky question and it's about predicting, but what you all think, can we see the rise of indicating mental health problems in next rounds of EUROSTUDENT? And is it because the awareness is getting higher and it's not a taboo to talk about mental health problems? Can this be the reason behind the higher and higher shares, or how do you see that as researchers? Joris, Ardita, maybe?
Yeah, that was also a thought I had, and I looked at if other researchers had investigated this, whether awareness leads to higher well, reporting of mental health. I only found one paper which concluded that this wasn't the case. So they could not find evidence that more awareness leads to higher rates of well, not reports of mental health issues. So yeah, I also thought that that would be a factor. Yeah, of course, which we mentioned before, I think the COVID definitely had a negative effect on well-being, and I think there are some research papers which already show that a year after COVID, things are getting better, but still, partly, of course, it will not be 0% students having low well-being. So I think there are underlying factors such as the global issues, study issues, which will be, of course, the same or could get worse.
Indeed. Also, a question to all of you, that now when you have investigated the data thoroughly and looked at different variables, what could be your next research ideas? Any further topics that you recommend looking into?
It would be nice to include the topic of mental health again in EUROSTUDENT. I'm not sure if that will be the case, but it would be nice also to tackle the question of, is this because of COVID, or is this because of this? If you can look at it over time, it would be more interesting also for further research. Now it's just, we just have a measurement at one point in time. So yeah.
Yeah, there's a comment from Yanis who says that he thinks that the topic of inclusiveness has to be in perspective as well. But yeah, if there are any other questions, you can still put them to the chat. We have a couple of minutes. There's also a question about getting the slides afterwards. If all authors agree, we can upload them to the EUROSTUDENT webpage with the recording, so you can have both the recording and the slides later on.
Now, Madeleine, considering your question of further research,
Yeah.
After receiving some comments for EUROSTUDENT, I think it would be for the intelligence brief. I think it would actually be really interesting to look at the relationship between like financial counseling and the effect of financial issues that students are experiencing, to see the measure of how much does financial counseling actually reduce those effects, and also to look at like mental health counseling in general, how much the stress burden is reduced if one receives mental health counseling. So this would be some interesting topics to look into in more detail.
Yeah, so not only the prevalence of those support systems, but also their efficiency.
Yeah, exactly. And well, if this intelligence brief focused on the problems, we could also like look at the efficacy of solutions. So that's an interesting thing.
Yeah, indeed. There's a question. Is there any indication or even research which kind of academic integration might improve the well-being among students? I think in EUROSTUDENT 7 there was a thematic review about, or at least an intelligence brief about students' social integration, but maybe Joris and Ardita remember and know more, so maybe you can answer to that question.
Yeah, it has been 3 years ago, but yeah, there are different aspects of academic integration, of course. So it's relation to the teachers and to fellow students, but also within the whole system. I'm not sure on which type intervention should be focused. But of course, there are interventions like having introductory programs, things like that, which leads to more integration with fellow students. But I'm not sure if there are reports on, yeah, there probably are a lot of more local researches on these matters.
Yeah. If there are no more questions, I think we can wrap it up. Thank you all for listening. Special thanks to Ardita, Joris, and Mikael for your presentations. It has been a very fruitful webinar. I can already tell you that you can save the 17th of October in your calendars. This is the date for the next EUROSTUDENT Talks, and we are going to talk about EUROSTUDENT 8 results in Hungary. Also, as you probably can assume, EUROSTUDENT 8 intelligence briefs will be published soon. You can stay tuned via Twitter or X, whatever you are used to call it. And you can also go to EUROSTUDENT webpage, refresh the publications subpage there and see what new publications will be available. So thank you all. Thanks for coming. Thanks for joining, and see you next time. Bye.